Welcome to all. Myself Udhayavani. My topic is laser instrument of surgery. The content of this presentation is introduction, common indication, types of laser surgeries, and removal of tumors using vocal cords. Then move on the introduction. What is laser surgery? A laser surgery is a type of surgery is used as a light beam to medical surgery procedure. Laser will be called as a light amplification by simulated emission of radiation. Laser were first developed in 1960. The laser light is not having a regular light, but the regular light from the sun or light bulb. It having a many wavelength and spread out all the direction. But the laser light having a one single wavelength, it will be focused by the narrow beam. It having a powerful and precious laser light. The laser can be used in the blades. It will be carefully used in the surgical work, so that is repairing the damaged retina in the eye or cutting through the body tissues. Then common indications of laser surgery. First one, to remove the tumors, and it is also prevent the small blood vessels, and it is used to decrease the spread of tumor cells in the body, to also treat some skin condition, that is removing of tattoos, birthmarks, and scars. These are the common indication of laser. Types of laser. The lasers are named by liquid, gas, solid, or electrical substance, but it will be creating a light. Many types of laser is used in the medical application, but few nowadays three kinds of laser commonly used in the cancer treatment, that is carbon dioxide, argon, NDOAG laser. Then the carbon dioxide laser. First type is called as a carbon dioxide laser, that is also shorted by CO2 laser. The CO2 laser is mainly a surgical tool. It is can cut or vaporize the tissues, and the light will be changes in the heat. It can be remove the very thin layer tissues, but it cannot be affected the deeper layer. The CO2 layer is also used in the remove the skin cancer and some precancerous cells. Then move on another type, organ laser. The organ laser is only used a short distance into tissues. It is useful to the treating the skin problems and is a eye surgery. This type of laser is also kills the cancer cells. It is also called as a photodynamic therapy, that is a PDT. Then move on to NDOAG laser. The NDOAG laser is used to penetrate the deep into the tissues. It can be a bled too quickly. The laser light can be carried out the optical fibers to the internal part of the body. For an example, NDOAG laser can be used to the throat cancer treatment. The laser having some advantages, that is a probe of laser surgery. Then disadvantage, cons of the laser surgery. Pros of laser surgery. The laser surgery is more precious and exact than blades. For an example, the laser will be cut in near, that is cannot be affected by the little contact of skin or other tissues. The heat can be produced by the laser to help clean the edges of the body tissues that can be cutting or reducing the risk of the infection. The laser heat heals blood vessels. There is a less bleeding. Pain at operating time may be shorter. For an example, the fiber optics laser light can be directed to the part of the body, the very small cuts, without having to make a large incisions. More procedure to done by the outpatient setting. Healing time often shorter. Then another that is cons of laser surgery is a disadvantage. Laser equipment cost lot of money and bulky compared with the usual surgical tools used, but advanced technology are slowly helping to reduce their cost and size. For an example, the entire surgical team and patient must wear eyes protection. This is the effect of some laser treatment may be last long. Then removal of tumors of vocal cords. Introduction. Vocal cord surgery is performed to Vocal cord surgery is performed by the vocal cords having a growth such as tumors or other masses needed to removed by the function of the body. It is also performed to normalize the vocal cooling function when the vocal cords are scarred from the various causes other or otherwise abnormal. These are conditioned to interference with the completing opening or closing the vocal cord, which is a necessary or normal speech and breathing. Performing of vocal cord surgery. The surgery on the vocal cords can be performed either directly in open surgical approach by neck or indirectly through an endoscopy approach to using the tube on the mouth and throat. Either the procedure is performed under the general person is fully asleep. Thank you.